Just because your teeth look good doesn't necessarily mean that they're healthy. Hi, I'm Dr. Ellie, and in this video, I'm going to talk about implants. In the 1930s in England, if a young couple were getting married, it was pretty common to see on their registry list that they would request a set of dentures each. You see, teeth were seen as nothing but a pain. They would decay, they would get painful, they would have nights of sleeplessness, they would have to go and have the tooth taken out when it got loose. So why not just have them all out, get rid of all that pain and suffering, and simply have a nice new set of dentures? And that was pretty common. And nothing much worried anybody until in the 1960s, actually at the dental school where I was studying dentistry, they started a pilot study in a convent with nuns. That study has since grown into quite a big study. And they were linking the earlier that teeth were extracted in life with a higher risk of dementia in women. There started to be a new philosophy that maybe having your teeth out early is not such a good idea. And as most people today, certainly in America, know, every effort is made to fill a tooth, to crown a tooth, to clean around teeth. And then when we get to the point where it's all so deteriorated, the offering is made of a nice new tooth, a nice new implant tooth, in the very same way that dentures seemed like such a great solution for all that pain and suffering. Let's just have a nice new tooth. I think what people don't understand is that an implant is not a nice new tooth. It's a metal screw with a fake tooth on the top of it, and it's not sealed to your mouth in the same way as a normal tooth. This means that an implant is at much higher risk of becoming infected, of damaging the bone with this infection, of you losing that implant, and potentially of difficulties keeping that implant clean, and those difficulties actually resulting in inflammation in your body. Sometimes I wonder, is an implant actually a better solution than a denture? Because at least with a denture, the tooth was gone. I'm not saying that everyone should have their teeth out, but I am saying that you should not see an implant as a new adventure, like a third set of teeth. Get your mouth healthy. You see, the difficulty for people is a nice, pretty line of teeth is what most people think is a healthy mouth. Mouth health has nothing to do with how many teeth you have in your mouth. Has nothing to do with whether they're lined up, whether they're white, whether they look pretty. Your mouth health has everything to do with a balance of bacteria in your mouth, of not having pockets, whether it's around a natural tooth or an implant. You want healthy gums tight around your teeth or tight around the implant. Then your mouth is healthy. And I do believe that testing the liquids in your mouth, doing this salivary test that can be done, and you can either do a home test or your dentist certainly can arrange, and I think there's some online places to arrange to do what's called an oral DNA test. And they can tell you how many bad bacteria you have in your mouth. Your dentist can tell you how much pocketing you have around an implant or around natural teeth. And be aware that an implant isn't just a new tooth. If you have gum disease, you want to get rid of it before your implant. If you have a lot of decay, and that's the reason that you're thinking about an implant, be aware that that decay is a disease. And if you start using Xylitol on a regular basis at the end of meals, or if you start using my complete Mouthcare system, which is documented on my website and on other videos, you will gain control over this disease, over these bacteria in your mouth. And if you're using the right kind of technique to massage your gums with a good toothbrush that you keep clean, then you can improve your mouth health before you dive in to getting any kind of new teeth. So don't think of an implant as a brand new tooth. It's a replacement. And if it's replacing teeth that decayed, there's a very good chance you'll get disease around the implant. If you are replacing a tooth that had gum disease, your implant has very good chance in a few years of having something they will call implantitis. It's the same bacteria, it's the same disease. So clean your mouth in the sense of get rid of the bad bacteria, and you don't do that with an antibiotic. You do that by balancing the garden of your bacteria in your mouth. If you want to have a healthy yard with flowers and grass and not too many weeds, you have to plant flowers and grass and tend them. And then it's easy to get rid of the few weeds in your garden. If you take an antibiotic to try and clean away all the bad bacteria in your mouth, you will clean away all the good ones as well. And just like a garden, if you blowtorch your garden, get rid of all the flowers, the grass, and everything, what's the first thing to come back? Is going to be the bad bacteria, the strongest ones, the worst and most difficult. And it's exactly the same in your mouth. You can't do this with antibiotics or strong antiseptics. You do it by gradually nurturing the good bacteria in your mouth with xylitol and with habits. This thing of not eating and drinking for an hour after a meal, if you can do that, very, very helpful. And then the sequence of mouth rinses and care that I recommend is tailored specifically to nurture and help the good bacteria while targeting very specifically and in a very organized way the bad bacteria. And it takes time. You're not going to change everything overnight. If you come back and you look at your records for the bad bacteria in your mouth and you find that they are high, my strategies tend, when we look at the reduction in these bacteria, it will be between a 5 and 30% reduction every 12 weeks. So gradually you will take down these bad bacteria, maybe over 3 months, and then you may want to have a cleaning or reevaluation. Or you can keep going for 6 months and you should have even more progression towards a healthy mix of bacteria in your mouth. So this whole change may take 2 years. But the coolest thing then is it's a change where your mouth will remain healthy. Your implant will remain healthy. You don't have to worry that you're going to lose your teeth or lose your implant or have tooth decay anymore. I'm so sorry my father lost all his teeth at age 35. But I'm so happy. I know, I'm confident for myself and my children and my grandchildren that there is a far better way.